Now that the nation's youngest children can get COVID-19 vaccines, the president and first lady will visit a vaccine clinic Tuesday to highlight their safety and effectiveness. The FDA greenlit vaccinations for kids aged 6 months to 5 years old last week. The CDC then recommended the shots over the weekend. Dr. Susanna Hills is here with me now to discuss. She is a pediatric airway surgeon and assistant professor of ENT at Columbia University Medical Center. Welcome. Thank you for being with us. So according to the CDC, just 43% of children aged 5 to 17 are fully vaccinated. What should we take away from that uptake in that group of kids who are a little bit older than the group that's now got them available?
Yeah, well, it tells us we have some work to do, even in the kids who've been eligible for months. So I think the conversation is going to continue to go on between families and their pediatricians as this youngest set of kids is eligible for vaccines, getting families, getting parents to come into their doctor to ask the questions that they have about the vaccine early so that they can be prepared is going to be really key to continuing this push to getting more and more kids vaccinated.
What do you think is the most important question or most important thing parents need to know?
Yeah, first and foremost, I want everyone to understand this vaccine, both of these vaccines, Moderna and Pfizer, are safe for kids as young as 6 months at the doses that they've tested. So we've had a large number of kids get these vaccines. The side effect profile is really, really low, and we know they're safe. We also know, in addition to that, that these vaccines are going to be effective. They looked at nearly 500,000 kids in Denmark who got vaccinated, and it showed that the kids who got vaccinated were 9 times less likely to develop severe inflammatory syndrome with vaccines. So we expect them to be safe and to keep our kids from getting severe illness.
One of the things you hear many things, but one of the things you hear is that, well, but not that many children have gotten very sick from COVID-19. So why do I want to go in for a 3-shot regimen and go through all the rigmarole? What's your answer to that?
Yeah, it's a great question. A lot of kids have gotten COVID. A lot of kids haven't had severe illness. But what I want families to think about is the fact that in this youngest age group, COVID is one of the leading causes of death still for vaccine-preventable illnesses in that age group and also for older kids. So it is a leading cause of severe illness that we can prevent. The other thing I want people to know is that I'm still seeing kids with complex medical conditions who are ending up in the hospital. Every month I see them with COVID because their sibling might be healthy, their sibling might not get severe illness, but their sibling may give it to them, for example, or a neighbor or a classmate, and they end up in the hospital with severe disease. So it's really important to think, yes, it's important for your family, but also it's so important for your community, for your school, for those around you who might be vulnerable.
And speaking of the community, I was walking by a jungle gym the other day. All the kids were wearing masks. All their teachers were wearing masks. Presumably, if enough people get the vaccine that's now available, presumably those restrictions would go away.
Well, that's the hope. But to your point earlier, we have kids, a lot of kids who are eligible who have not been vaccinated yet. And so in order to get the mask requirements to be lifted fully, we're going to need enough kids to get vaccinated where we won't get a surge. When numbers go up, regardless of whether vaccines are available, masking may be recommended again in school.
All right, Dr. Hills, thank you so much for being with us.
Thank you.